Hey everyone, welcome to this webinar on lupus skin and hair. We'll start in another 5 minutes while we wait for more people to join. Meanwhile, please follow these guidelines on the screen so that we might have a great session. Please keep your microphone muted, and end of the session, the doctor will take all your questions. So please share your questions on the chat box.
Good evening. Can you hear me?
Good evening,
Hello.
doctor. Hello, yes, you're audible. We're just waiting for 5 more minutes for the rest of you to join. So we'll begin shortly.
Oh, yes.
Yeah, we'll begin now. Welcome everyone to this webinar on lupus skin and hair. This session is a part of a month-long webinar series hosted by Lupus Trust India Karnataka chapter, where we have interactions with doctors from different specialties who treat lupus patients. Lupus Trust India is the only patient-led advocacy and public charitable organization for lupus patients in India. Our core mission includes campaigning for awareness, providing financial aid for disadvantaged patients, advocating for policy changes, and providing community support. Now, I'd like to extend a very warm welcome to our guest speaker, Dr. Srinivasa Murthy, who is a senior consultant dermatologist practicing in Bangalore for over 35 years. He was one of the first to start dermatosurgery in Bangalore, and his special interest lies in treating pediatric dermatology, dermatosurgery, psychodermatology, and aesthetic dermatology. He was also awarded for one of his paper presentation on exfoliative dermatitis. We're all very excited to have such a great mind here with us today. Welcome, Dr. Srinivasa.
Thank you.
So throughout this webinar, we'll be covering topics like symptoms, treatment, discoid lupus, and prevention of skin-related flare-ups and conditions. So as we all know, some of the earliest signs of lupus for a lot of patients are skin-related conditions like rashes, skin inflammation, severe hair fall, scalp rashes, etc. So it becomes really important and critical for lupus to be diagnosed at this stage before it affects major organs like joints, kidney, liver, brain, etc. So, doctor, can you elaborate on the different types of skin and hair conditions that lupus can cause? And how can we differentiate between lupus symptoms and other common skin and hair conditions?
Yeah. Systemic lupus erythematosus is a autoimmune disease. Usually, we see in the skin we have an acute condition or acute lupus erythematosus, subacute, and chronic. There are three kinds of skin manifestation in lupus. And most of the time, we have a mala rash, typical mala rash, that is a rash over the nasal bridge on the cheeks here, which spare this nasolabial folds, red patches. Most of the time, non-itchy, be red, sometimes with burning sensation, and it becomes more and going exposed to sunlight. This is a typical rash you see in the acute lupus erythematosus. Then you also have sometimes the rash is so bad you get on the other part of the body, on the exposed part, basically arms, neck. But usually we see a typical mala rash, and we liquid the mucosa and the oral mucosa. Into the under hard palate, you can see ulcers, painless ulcers. This is the most typical any student we tell them about how to look in for a systemic lupus rash. Then this is acute. This is a subacute condition where you have uh, a round like a patch, a round red patch on the body, exposed parts again, non-itchy. Anything non-itchy, you have to be careful with it. And we always say anything non-itchy, itchy is good. Non-itchy is something we always worry about it. So you have a non-itchy on the exposed parts, red, and center clearing. The center portion will be red and the outside will little rise. It looks like a fungus-like thing. Fungus like a rash, which is non-itchy, and exposed to sunlight become little more. That is called subacute uh, uh, lupus erythematosus. There's a condition called chronic is there. In that we have discoid, again round, which got a thickened skin on the patches, red patches again on the exposed part, either on the face, above the neck, or sometimes exposed per arms also. All exposed parts, there is extensions. This kind of part on this part of arms usually get exposed. Where the sun is exposed, skin is exposed sunlight, those you get discoid lupus erythematosus. These are typical acute, subacute, and discoid. In this chronic one is a discoid. We also have little other variants where you have the fat getting involved, panniculitis. So it will be depression. It will be above the waist area. You have depression of the skin. Again, painless. Sometimes a little, so sensation will be there, and there's a depression. And along with that, if you get a rash on the hand, the discoid, which is lupus profundus. The other conditions you have hair getting frayed and breaking at the edges. So that is a common. You have extra hair loss typically. This is called in SLE. In discoid, you have the same patches on the scalp get involved, and you permanently lose hair. You get a full patch. If you don't start the treatment early, you permanently lose hair there. These are typical conditions. You also have this along with that, arthralgia, joint pain, You have chilblain-like lesions. The tips of the hands become reddish and little painful, very sensitive. And you have a nodule, a small rubber-like thing on the very rarely on the knuckles. These are other symptoms you look into it. Typically, non-itchy red erythematous red patches on the nose and the cheeks is a common thing we see.
Got it. Thank you, doctor. Thank you so much for explaining all the different kinds of symptoms that most of us have gone through already. Thank you so much. And the next question is, doctor, uh, what are some of the diagnostic tools to identify lupus through dermatological symptoms? Can you tell us more about skin biopsies and hair biopsies to diagnose lupus?
Hair, we don't do any biopsy. Scalp biopsy, we do. But scalp biopsy, nowadays we have a dermoscope. So you have a dermoscope. It's a very good tool to check the hair and scalp. Very easy to find out. We've got typical features of the dermoscopic features. So we can make out with the dermoscope. Very easy tool. Every now, all youngsters have this dermoscope. And that will show that the follicular plugging, of the in the discoid. You have a follicular plugging. You have like a cigarette paper like attachment. You know, when you have a thing as if you've got a thinned out paper. In discoid, you have a thinned and thick. Both are there. The skin becomes thinner and thicker. So that can be seen in a typical dermoscopy. So I'm talking about the non-invasive thing. Simplest thing is that non-invasive. And we have same dermoscopy. If you see on the face, you can see a dermoscope shows the blood vessels, vasculitis, inflammation of blood vessels now. And ultimately biopsy. Biopsy we do, but usually when you see a study, more than a biopsy, we do the immunological studies in the blood. That will give a good diagnosis. We correlate the diagnosis. If you do a biopsy, we do for basically for any vasculitis is there, any complement. We do an immunofluorescent test when you do a biopsy. Two kind of biopsy: histopathological biopsy, where we see the histopathology of the skin. We have immunofluorescence. There are a few people few places right now. A lot of medical colleges do it, and that will show the deposit of IgG, IgA, hemoglobin A, G, and M on the complements also on the dermoepidermal junction. That also gives a clue on a biopsy. Biopsy typically have and you know that LE cell usually we do see in other part of the body. Very rarely we see in the skin. LE cell is a lupus erythematosus cell. That's the commonest we see that. But dermoscopy is a very good tool now, and we do biopsy also. And in the scalp biopsy, same thing we see atrophy, dystrophy means atrophy thinning of skin, and inflammation of skin in the blood vessels. And again, we can see the same features of deposition of complement and the IgG, IgA, and IgM.
Okay, got it. Understood. Thank you, doctor. And a major trigger for lupus flare ups, especially flares of skin symptoms, is sunlight. So, we are advised by our doctors to put on high SPF sunscreens and other sun protection gears. So, can we talk about photosensitivity and why sunlight is so triggering for lupus, and what are some of the best practices to make sure this does not limit lupus patients from living a full and active life?
Yeah. Sun, sunlight as well as light, ultraviolet rays can trigger. That is not, if you have ultraviolet like a tube light, a TV light, that can also trigger. So you have to use sunscreen lotion round the clock and SPF 50. Any sun protection factor of 50, that means it's a good, basically, now we don't see about SPF, we say uh, sun, sun protection factor basically is UVA, we see UVA and UVB, and we also do uh, physical light. I mean, we know the visible light. So give us nowadays, we got very good sunscreen lotion, which also contains the physical and the chemical as well as the visible light. So we have to use sunscreen lotion, and you have to apply if you're going out half an hour before going out of the house and every 4:30. But whether you go out or not, we always tell them at least by 8 o'clock, assuming most of the people don't go out by 8 o'clock. Or in we find out the what is the daily. Some people go early in the morning, they go to work by 6:30. Then you apply half an hour before. Like I'm talking about Bangalore scenario. Bangalore is 3,000 feet above sea level. There is more sun here. You think it is cloudy? Is not. No, there is no cloud. Also, UVA comes through the cloud. UVB doesn't come through the cloud. So you have to use a sunscreen lotion. We have light or not. They in very, especially in Bangalore, people don't worry about sun. Okay, don't not worry at all. They don't even carry an umbrella in during rainy season. That's a very funny thing we see in Bangalore. In South Canada, they're very particular. In Bangalore, in Goa, example, where sun is the temperature is hot, but they can carry regularly because there's rain always there. Anyway, so we have to use sunscreen lotion, and that's only blocks 40%. Okay, there's only blocks for not 100%. Sunscreen lotion not. What the cricketer uses, zinc oxide, that gives you around 80%, 80 to 90% zinc oxide. But we can't use that. Zinc oxide, whitish look like, as if we have got a theater or something like a makeup, we can't give. So we have to use sunscreen, which is acceptable for the other people. You can do a daily routine. So we have good sunscreen lotion. We have to cover with thick scarf for a woman, broad brim hat, if you're in a two-wheeler helmet, and also telling you if go in a car, lovely. There are people argue with me. I've got a lovely car which has got a what do you call it? Solar protection. Nowadays, all the high-end cars come with sun protection, like glass. So that is not good enough. You will be penetrate. You will penetrate to that. So I tell them you have to use sunscreen lotion. I mean, and plus a scarf, thick scarf while driving. You have to do that. And you have to wear preferably ultraviolet A protection goggles, broad goggles with that ultraviolet. You don't have to wear Ray-Ban. You can use any one, which is a broader uh, frame with sun protection, 100% UVA blocking goggles. So you have to use that. And 10 to 4 is the worst sunlight. You have to be very careful between 10 to 4. Other time also to be careful. So ideally, when you got, and if you walk, if you swim in the water outdoor, you have more reflection. So sun protection, even sunscreen lotion wash off within 20 minutes. So whatever is sunscreen lotion, whatever water resistant, it doesn't give you any good protection at all. It goes off, and you cannot keep getting up and putting on sunscreen lotion. So ideally, if you go for swimming, indoor pool, or either late in the early in the morning or late in the evening, after 6 in the evening or early 5, first batch, you should go for swimming, and it is more near the snow, snow-clad mountains. It reflects like anything. More near the water and more near the sand. You have to be very careful. So whenever that's a very difficult situation. Anything skin, any problem in the skin, exposed part, forget SLE, any other condition, people get tanned. Indians don't like to get tanned. So they have to use sunscreen lotion. And when they go out, they do all these activities. And now everyone in every second I see any holiday place, any place, they keep on taking selfie. So keep on taking selfie everywhere and keep on exposing light. And my patients go for a holiday, they in any other condition, they become bad. So it'll be tell them very tough, very tough. And especially if you're in SLE, this is okay. If you're in SLE, it triggers pains, hurts, and triggers your whole system, immune system. It's very difficult, and you have to be very careful. And you have to use sunscreen lotion. And physical means the must. Full arm shirt, thick one. The fabric should be not like this. The fabric should be thick. I always tell them it should not light should not pass through the fabric. Thick one, thick cotton one. And then you have to use a scarf or a dupatta, and you have to wear a full arm cotton protection for your arms if you're not wearing a half sleeve or something. So you have to use sunscreen lotion. Exports, but be very careful. And physical means is a must. And sunscreen lotion every fourth hourly. And if you're on a holiday, if you sweat a lot, you do every 2 second hourly. When holiday, it will sweat. When you sweat, the sunscreen lotion goes up. So every 2 hours, you have to use sunscreen lotion.
Got it. Thank you, doctor. Thank you so much for your very insightful advices. A lot of us are very used to be very physically active, and being afraid of sunlight is something that hinders our hobbies as well. But thank you so much for your advices.
You can do your activities, cover yourself, and when you are doing some marathon and all, very difficult because it's very tough. That's a very tough thing. Only marathon is tough. Playing tennis and other things, games are okay, but marathon, you sweat a lot. That's why.
I just got it, doctor. All right, moving on. Uh, what is a typical treatment protocol for lupus affected skin and hair? What are the important things to keep in mind while going through a skin flare?
First and foremost, protection, physical protection, chemical protection with sunscreen lotion, the must. The most important, if you don't do that, it will flare up. Whatever treatment you use, it will flare up. And we have to be very calm. Basically, I always tell the patient has to be very calm when the stress levels high. Lupus does flare up. So that's very important. That comes to the usual, my fund of meditation yoga is very important for any skin condition. So I'll talk about that. And the flare-up comes, we have a mild to moderate. If it's very bad, I usually start with mild to moderate potent steroid creams. I give for a few days, I'll withdraw, and then now we have got very good alternative called pimecrolimus and tacrolimus, calcineurin inhibitors drugs. The ointments and creams are very safe. You can apply for 100 years, hardly any side effect. It does give the same effect as steroid, but it is not quick. So we start with a steroid, and to become better, we withdraw steroid within few days and switch over to this and sunscreen lotion. And for the exposed parts, lupus hydroxychloroquine. We'll come to you. Maybe you have a question later on. You can ask me later on. But typically we give sunscreen lotion, application of topical steroid, and if it's itching, we have an antihistamine. And the first drug of choice we have hydroxychloroquine. It protects you from sunlight. So that tablet we start off. And if it is SLE, we check the eyes first, look out for a retina, and then because you're going for long term, I usually give for many other sun-related skin issues, like polymorphic light eruption, smaller issues. There I give for only for a few weeks. I don't bother about the eye. When you give for longer term, a higher dose, so we have to check the eye before that. Very rarely I see, it's a theoretical thing, very rarely I see, but make sure that, patients should not have a problem of the medicine. So make sure that, and then you check the periodically after a few months. Okay.
Okay, got it. Thank you. So, lupus drugs, like a lot of us lupis, we periodically take drugs like steroids, HCQS, and other immunosuppression medications, which has a lot of side effects on both skin and hair. So, immunosuppressants can cause skin infections, and there have been cases among patients where pimples and boils have turned into abscesses. So, can you, doctor, talk about some major skin side effects to watch out for while on these medications, and how do we prevent them from becoming worse as we age?
Methotrexate we give is a wonderful, safe medicine. It doesn't give any side effect for the skin above 60, 80. I mean, about 60 age and 65, 70. Those people on a methotrexate higher dose, we do a flare-up of herpes zoster, okay, that we see. Abscess, I have been, my favorite drug is methotrexate, give many skin conditions. We hardly see any this pyoderma, that is furunculosis, pus-filled void. But microphenolphenoate, and that's the one, other one what you give is uh, thalidomide. Thalidomide is again, many doctors do give. Uh, we do have vasculitic-like features there, and we have other psychosomatic-like features are there. But skin-wise, uh, we do very rarely thalidomide does suppress. We do get uh, uh, blood clotting like phenomena sometimes, and you do get very rarely pus-filled boil. The pus-filled boil is only because of oral steroids. The moment you give oral steroid, you get acne form eruptions. Okay, there's a more, see, the commonest immunosuppressive moment you want to reduce this thing SLE or flare up, you have to give oral steroid. The oral steroid, the moment you give, you load it up, you put on weight. When you give a more than 40 to 60 mg per kg per day, and for longer time. If you give for 2 weeks or 3 weeks, okay, the moment you have to come down, you have to reduce the dose, and most of people do it. But if some people, even that small dose itself, they load up, they get this pus-filled boils. The acne, definitely for a woman, acne flare up with plenty. So acne flare up will be there. You get pimples, active form eruptions you do get, because still acne is different. Pimples are different. Pimple form eruptions are different. Where you have monomorphic, only in a pack, red boils and a pus-like thing, only you see either one of those. And that we have to give topically clindamycin gel. We give, we also give tretinoin, and if required, sometimes we give a short course of antibiotic. Pus-filled boil, I usually don't give. I give my mupirocin cream is a very good thing. I talk on more on a simple treatment, like, if you get a pus-filled boil, do a whole time treatment, hot compressors, hot water compresses, followed by a salt water cleaning, a warm water with normal saline. You clean it up, and then you clean the pus and use either miprazin or any fusidic cream. That's good enough. But you have to come out of steroid to come out of it. But there are people who get small dose also, they do flare up like this. So this is a little challenge when you're steroid. Other medicines, we don't see that. Uh, what other medicines you take? Tell me. What are the most
Uh,
typical take?
we had tacrolimus
Tacrolimus.
and
Yeah. The oral tacrolimus is very safe. I hardly see anything, but we see sometimes the kidney problems. Tacrolimus doesn't cause any skin. Oral or a topical. That's the commonest people give tacrolimus.
mhm,
Tacrolimus is very safe. I don't see any because no, we are multidisciplined. This condition requires a multidisciplinary treatment. So we, a nephrologist, a rheumatologist, a dermatologist do play. Initially, dermatologists do play. They come out of it quickly because rest of things all it goes to a kidney or a lung or a heart. Then they'll take care. So, but we have to, all three of us, four of us has to sit and talk about a plan of treatment.
got it.
Have I covered anything about the boils? Yeah, that's all. I don't give antibiotic. Very rarely I give a short course of oxythromycin. I give. Otherwise, I don't give a high dose of antibiotics because they're already suffering. I don't want to give much. Usually, I don't give. I manage with that. I counsel them and tell them to improve the immunity is very important. I talk a lot on diet and meditation, yoga. That gives a very good relief and body become confident and strong with just that because yesterday the chronic process is lifelong. So you just can't one day, 2 days, no. You have to think about lifelong. You cannot pump yourself with so many medications. Reduce the medicine, and it's the simplest thing you have to manage.
Thank you, doctor. Thank you so much for your input. Now, moving on. So, we're going to talk about lupus related hair loss. So, how can one differentiate between hair loss due to lupus versus hair loss due to lupus medications? Does treatment differ in these two cases?
Yeah, lupus, because of lupus, you get a frayed hair, hair breaks, and do get sometimes people have a hair thin in the front and this area, parietal and temporal area do have hair loss. One is I'm talking about acute cutaneous lupus. Discoid cutaneous, you have got a non-scarring alopecia where the moment you don't treat, you'll have a round patches like a bomb. As somebody has put a bomb in a thing, it's gone. Before, if you don't treat early, the hair is not going. It's scarring alopecia. There are two kinds of alopecia. Alopecia means hair loss, scarring and non-scarring. In discoid, that is a chronic one, you have a scarring alopecia. You have to treat very early so that you don't topically steroid aggressive hydroxychloroquine. So that it's a very good. Discord is a very easy to treat actually. Discord lupus is very easy to treat, and we get a good outcome in that if we start very early and the patient come very early. Now the thing of how to differentiate a hair loss that the common medication steroid, oral steroid hair loss is called telogen effluent. So when you give the hair, three kinds of hair, anagen hair grows for 3 to 4 years. It shrinks for a few weeks called catagen stage. It takes for a few 9 months to rest in a called resting stage called telogen stage. So whenever you have a major illness, any major stress, the telogen hair, resting hair, about 1,10,000 will be in that 10%, means 10,000 in that resting stage. They tend to fall faster. So you can see anywhere other part of the house, you can see hair fall, especially women lengthy hair, they get scared. They start having a lot of hair loss. It's temporary. Once you correct yourself, it will come back. It is not scarring. It's just a diffuse all over the head. Scalp, you lose hair. Acute, you have hairs breaking and falling, and also and these areas hair become thinner. Okay, and you do a pull test. In certain areas, we at least take 10 to 20 hairs and pull it out. The pull test is positive. It will be intelligent effluent. That means it is a because the medications. After the patient will tell me after medication I start losing hair. So that's typically they tell you. And before that they come with hair loss. So we usually see hair loss, mala rash, and fatigue, fever. The moment we think of the SLE, commonest thing we think of SLE, but especially this is how we see about it.
Okay. Thank you, doctor.
And other thing, you have a
Mhm.
dermoscope. Now everything is on dermoscope. We put a
Mm,
dermoscope, see a scalp, and see that what kind of hair is gone and what are the dots, red dots, white dots. These are the things which is fibrosis is there, the blood. So this is very simple. We have a textbook on dermoscopy. People refer it and read it, and then do a diagnosis.
Got it. So, doctor, is there any hope to gain back hair for lupus with scarring alopecia?
No, if you have a discoid lupus dermatitis, where you have somebody saw some question, if you have a scarring alopecia, very difficult. You have to treat early before the scar appears because it's completely, the damage is gone. So you won't get it. And that even if you do hair transplant, there, if you become all red, the chance of hair staying there is also difficult. Because there's no dermis. They have skin has got three layers, epidermis, dermis, and fat. The dermal layer is totally destroyed because of discord. So to start early, and best way if you have fully packed, you have to put this that fiber, carbon fiber, this could camouflage it. So if it be only few spot, a large spot, we very rarely we see nowadays. People we don't very rarely in big cities. The moment they come to big city, rural villages come to big city faster. So we those days many years back, 35 years back, we should see bad scarring. Not taking care. Now think people are aware of even in smaller cities are aware. They come immediately to a doctor, so it's be easy for us. Hardly see any bad scarring elevation in my life last at least for last 10, 15 years.
Thank you, doctor. Thank you for your answer. And now that we're talking about discoid lupus, approximately 25% of patients with SLE may develop discoid lupus lesions at some point during their illness. Conversely, only a small percentage of patients with discoid lupus may develop SLE. Some studies also indicate that around 1 to 5% of DLE patients may progress to SLE. So this makes it a niche in lupus treatment. So, doctor, can you elaborate on the nature of discoid lupus and the treatment needed?
Discard, you get painless. Actually, people come, don't bother. Painless, sometimes little irritable on the face, on the neck, on the scalp, sometimes the hands also. Rash, red rash, a coin like rash, and then it'll be scaly and it'll be thicker sometimes, it'll be thinner sometimes. And if you remove the skin of the tire, and if you can see the bottom, you can see black dots, and it's like a cigarette paper, like so very thin paper. So that's how it looks. But typically, that's how we see on the scalp, eyebrows, sometimes you get it on the face, ears, especially we see on the ears, exposed part, on the neck. Sometimes the hands also, extension of the hand. Extension means this kind of this portion of hand do get. And it be sometimes very rarely itchy, uh, non-itchy most of the time, itchy and painful. So very some people come with pain, especially in the exposed sunlight. That's the pain comes when the exposure sunlight is bad. We see the farmers and the villagers, they see that we see quite often with them. They're coming only because it's not that they don't worry about the disfiguring, the pain. Disfiguring is the last thing for the villages. But in cities, disfiguring is the most important thing.
Got it. So, what is a typical treatment for discoid lupus?
Typically, start the topical steroid immediately, give a sunscreen lotion. If it's itching, we give an antihistamine. If it's we have to give hydroxychloroquine is a must.
Hmm.
Must. And it responds. If it is bad, initially we give short course of steroid. It gives a quick relief, and it's very good. Short course steroid with hydroxychloroquine controls and come out of steroid as early as possible. We give methylprednisolone. Uh, Usually don't give prednisone alone. Methylprednisolone is a better drug if you think of a longer term. And you have to give I give an alternative days of 1 day higher dose, 1 day lower dose, all in the first thing in the morning. Steroids should be given always in the morning when the steroid levels are high, and single dose ideally, not multiple doses. There are still doctors giving multiple doses. Usually multiple doses doesn't give such kind of relief and it gives more side effect. And methylprednisolone doesn't give much problem for the bone. Otherwise, prednisolone long term, it does make your bone brittle. Bone brittle. We give that. Typical. And sunscreen lotion. Full arm shirt, physical block, full arm shirt, caps, scarf, dupatta. Recorded. I keep talking every day.
Yeah, got it. All right. Thank you, doctor. So, are there any specific skincare ingredients that should be strictly avoided to prevent skin and hair related lupus flares? And what should a lupus patient's ideal skincare must look like?
See, ideal skin for anybody is the same like lupus. You know why? If you use anything which irritates your skin, okay, it gives you redness, marks, any individual. So a lot of people put a lot of product in the face. Not required, especially a girl a lot of products they put because either peer pressure or for various reasons they put, and to mask the face, something like. See, the simplest thing, it should be paraben free. The product should be paraben free and should be no fragrance should be there. Ideally, there are a lot of things coming up in the market, and should be, but we don't know about that. They say it's fragrance free. Do get a fragrance. So be very careful, and it be a water-based, a moisturizing cream is a must, which is be no fragrance. It's a simple moisturizing cream to put, and a face wash with its cleanser, not a normal soap. A cleanser, it is a pH is neutral, doesn't make your skin dry. Use a face wash with a cleanser, morning, afternoon, evening, night, 4 times wash your face. If it is dry, use a moisturizing cream, fragrance-free, water-based moisturizing cream, because most of the SLE happens around 20, 25, below 25. When you're young and the hormone levels are high, if you use an oil-based product, you can get pimples. So water-based product basically, no oil-free, fragrance-free, and less of the parabens. Parabens are known to cause that they are base of the medicine known to cause allergy. So you have to avoid that and use a moisturizing cream, use a sunscreen lotion. If at all you want, I ask them to use simplest is compact powder, a old-fashioned lacto calamine lotion. Lacto is a calamine thing, the pink one. It's like a makeup and put a powder. Most of people don't mean they feel bad to use that kind of simple products. They want to use high expensive product. They want to use a very expensive product. And these expensive products are not so great as you think because you pay money. It's not so great. It has got so many ingredients and it can cause for some people. I'm talking about pimples, the patient pimples and all. And people SLE, why you want to irritate your skin? Leave it as simple as possible. The most important product for you is sunscreen lotion. And that has been applied very nicely. And yes, we have a pea size. I always tell them a pea size 1, 2, 3, 4, 5 drops, full face cover nicely, thick, clear. And if it is oily face, use a water-based or a matte finished sunscreen lotion. If it is dry, use a water-based and a cream finish moist sunscreen lotion. Or should be everything be water-based nowadays. A cream finish will give a softness if it is a dry skin. An oil-based or a matte finish. A matte finish there's an oil-based what you cream finishes, and a matte finish is as if you don't know how they applied. That's a good for the oily face. And every day you have to use a moisturizing serum. That's fragrance free. I always say when you have a fragrance, suppose and people use spray, and if you put a spray again it contains a lot of fragrances. They have a reaction with sunlight, so it can trigger. So avoid fragrances, avoid perfumes, avoid body spray. I tell them, and avoid any smokes and fumes at home. And smoking is prohibited. Definitely, nobody should smoke. A lot of girls do smoke. It's a thing, but you should not smoke. And you should not smoke. You should not go to a friend who smoke in front of you. It's the worst thing to do. And you don't have a filter also. So you will die early than him or him or her. So you'll be careful. No smoking. And these are things and no chemicals preferably. Simplest thing.
Okay, doctor, we got it. Thank you so much. And you've also mentioned earlier how diet, meditation, yoga plays a big role for lupus patients. So, can you explain how diet will play a role in triggering skin flares and hair issues?
Yeah, now the diet is commonly thing is alpha sprouts can cause, and there are some legumes in that sprouts of that, uh, some beans, and they have a contains karen. The substance is called it's something like alpha. It contains carenamines or something that can cause trigger this very rarely. But alpha sprout is a definitely now. Rest of the legumes you take in moderate consumption. Now, thing is for a healthy skin, you got a healthy diet. So that play a role here. Only contraindication means no, not to take is this kind of alfalfa sprouts. Otherwise, no other vegetables or fruits are contraindicated. I mean, not to ban for the SLE and legumes. That is the more than legume that legume sprouts. Sometimes they say no in small quantity, not an issue. Okay, but alfalfa definitely no. Rest of the thing, always say 2 fruits a day, 2 salads a day, and 2 liters of fluids per day is a must. Liters of fluid per day if it is kidney is not affected. Okay, kidney is affected. This is a different story. So a morning, the best fruit I always tell me you have papaya is a very good fruit. It contains all the enzymes, very good for the health. Pomegranate is very good. And all the fruits are good. Papaya, pomegranate, vitamin C content like guava, all this are very good for your skin. Fruits. Vegetables, all the green vegetables, always tell them to have a raw salad before lunch and dinner with all the roasted yours seeds. All the seeds are very good. Pumpkin, watermelon, sunflower seeds are all very good roasted ones. You put in a salad before lunch or dinner and have a well balanced diet. Less carb, more proteins ideally. And bad carbs are white rice and white sugar and white maida. And anyway, for not for about yesterday, for anything else you have to avoid. And have proteins, any form of proteins, veg and non-veg, chicken, fish, egg, dal, paneer is a good protein. You have to have proteins for you. You require a good amount of protein. And vegetables cooked and pre and probiotic. Unless about pre and probiotic, raw vegetables and cooked vegetables and the curds are must. People are lactose intolerant, you can other kind of curds you can take. You should have food on time. You should have never. So a lot of people have a very bad lifestyle. Most of nowadays, they should have a breakfast by 8 to 9, lunch for 1 to 2, dinner by 7 to 8, sleep by 10, at least by 10 o'clock, get up early, and then meditation yoga plays keeps your mind calm. First of all, we don't autoimmune disease nowadays. They say it is because stress. I'm talking about not about SLE, stress and the gut flora. Gut flora has to be good. Okay,
Mhm.
stress I do manage by doing meditation yoga. Very, very important. Meditation is very good for any all sort of meditation is good for you. When you concentrate and keep your mind calm, the trigger level is definitely less. The most stressful, definitely, any skin condition become bad. Skin is a mirror of your health. Any problem, your mind is shown on skin. Okay, this is very, very important. So mind is calm, skin be calm. And then all your skin symptoms become bad. Urticaria, any allergy, everything become bad when your stress levels are high. You cannot manage your work, manage your family, get stressed out, all your skin inflammation become more. And meditation, yoga is very good. Very good yoga is part of it's good for everything and it's very good for skin. So I always tell you two things, meditation, yoga, and exercise is a must. Physical form of exercise is a must. Ideally, if you're for a century, you should do it in the indoor form. Zumba, aerobics, treadmill, cross trainer. You have to keep yourself fit mentally and physically. And food, no contraindication, nothing contaminates, not to avoid any food except this alpha and some legumes, which is sprout food. And you say legume means all your beans you can eat, no harm. Sprouted in large quantity is not good, but alfalfa, they say no. So definitely alfalfa sprouts are good. A lot of people don't take it, but some people do take it. We see in Kabam Park, in Bangalore. You are based in Bangalore?
Yes, doctor.
Best, if you see in my Bangalore, Kabam Park and Lalbagh, they come
Mhm.
with a machine with all the sprouts, juices and all. Okay. A lot of people take that. It's okay, healthy, but you have to be careful about that alfalfa sprouts. Rest of
Mhm.
things are okay. No food, but a lot of vegetable fruits, water, fluids, hydrate yourself. And these are things I always tell for everybody, including yourself.
Got it. Thank you, doctor. Thank you so much for your advices, inputs. That's all the questions that we had prepared for you, but there are a lot of questions in the chat box that
Okay.
we can address. So Haripriya asks to talk about shingles.
Yeah. Shingle, it comes when you're in an immunosuppressive medicine, especially you can uh, uh, have shingles in younger people also. There is basically a chicken pox where it reactivates when you're immunosuppressed. In high dose of steroid, you can get. The thing is, everyone comes to us on after fourth or fifth day. Okay, if it is below 40, okay, if you're below 40, if you get a rash shingles on the arms, you can get a first you get a shingle, you get irritation, itching, burning sensation. Before that, you get a prodromal symptom. That is, you get a vague fever, body ache one side, feeling, malaise. Then you get a pain in that area, either hand or tummy, whichever. And many times on the chest area, you get pain. Okay, if you got a chest, people go to a cardiologist because think it's a heart problem. And on the tummy area on the right, they think it's the appendix. I've got people who open an abdomen for thinking the appendix. Okay, because first 2, 3 days only pain. There'll be pain, and the pain severity goes, and then the third or fourth day you get a rash. First you get red dots coming in equal distance, red dot. It becomes pain, burning sensation. Then it forms a water-filled lesion. Then it becomes red. Then it crust. So that is the issue. The moment you get a rash, within 7 2 hours, if it's above 40, should come. Because if you're above 40, and if you come late, what happens? The nerves get affected. You get nerve pain called neuralgia, post-herpetic neuralgia. That's the worst thing. But usually 20, 30 herpes zoster, it comes and it forms a blister, it heals on its own, doesn't cause anything. It's some vague pain to be there. So for that we have acyclovir, valcyclovir, we put them on immediately and it gets controlled. And it is contagious for others who don't have a chicken pox. From them they can get chicken. Other people who don't have a chicken pox vaccination, not got chicken pox, they can get 25% chance of getting chicken pox from them. So if your child is not been vaccinated, or his husband is not got a chicken pox, he can get chicken pox. Chance are there. The first 3 days. Once you start crusting, it's healing, so you don't have to worry. First 3 to 5 days. So once you put them on antiviral tablet, it get cleared off soon.
Got it. Okay. Thank you, doctor. And most of the questions here, Dr. Srinivasa has already covered. So we are just, can you recommend some good sunscreen options or what we should look out for in the sunscreen?
Sunscreen lotion, you should look out for a ultraviolet A B coverage. Okay, SPF factor of 50. There are so many in the market. I prefer out of the counter. See, there are a lot of out of the over the counter products are there. I prefer you to go to a dermatologist who can give you a sunscreen lotion from a pharma. Now, why pharma? They go through Drug Control of India. It's a thing called drugs and cosmetics. Cosmetics. So cosmetics, they don't control it. Okay, anybody can do anything, and then we don't know the SPF. What is it? There are now they are very strict now, especially Drug Control of India, and they make sure that SPF is really SPF 50. What they say SPF 50 may not be SPF 50 many times. It be SPF 10. That they hardly cover you. So you should go to a dermatologist who will give you a good recommendation according to your skin. How he'll recommend, because what suits me may not suit you. Sunscreen lotion. Okay. Same thing the shampoo always say, I say, what suits a shampoo for me may not suit you. Okay. And for a hair care, I just forgot. If you have a hair loss and all, there are some misconceptions. Putting shampoo will not cause any hair loss, and shaving multiple times will not grow hair. Putting oil too much, you won't get good and thick hair. And oil massage is no help. Oil you put for hair to make a hair soft is a conditioning thing. And helmet will not cause any hair loss. Putting cap will not cause any hair loss. These are common, typical myths. Everyone have it. So if you have a hair loss because of lupus, the moment you start giving medicines, it become better. But when you hit with a high dose of steroid, again you have extra hair loss. Remember that it will come back. It'll come back. Ultimately, okay, acute SLE, you get a hair back. Discoid hair, that is discoid lupus erythematosus, chronic one, which we lose fully hair, that won't come back. So you don't have to worry about the hair loss. The moment third or fourth month we recover, steroid and tacrolimus, oral or methotrexate, whatever it is, microphosphamate, they do well. So don't have to worry about hair loss. It's only temporary phase.
Got it. Thank you, doctor. Another question from Dimple Akane is if we can do hair color, if you can color our hair.
Yeah, no harm in coloring. You first do a test on the cubital fossa here, few drops every day. You put it because hair contains hair dye
Correct.
contains paraffin and diamine. It's a common allergy. Every day I see at least one or two patients from so many years with hair allergy. They use for 10 years. At 11th year, they get allergy. Okay, they get rash. Other things, face become black. Okay, it's common, including hair, the face become black. So first you put in the cubital fossa, few drops every day for few days. If no allergy, you can use it. If you're allergic to it, you have to alternative called, which is doesn't have PPD, paraffin and diamine. So you should look out for a hair dye which doesn't contain paraffin, diamine, iodine.
Okay. Got it, doctor. I think we've covered this question, the best treatments for major hair loss. Any recommendations for shampoo, conditioner, and hair oil?
Yeah, first is any shampoo you can use. As long the shampoo make a hair soft and smooth. Hair oil doesn't cause any hair growth. You put hair oil to make a hair softer. The best thing for for the hair loss, I think, is you improve your supplement. Take your supplement. So sometimes your B12 is low, D3 is low. You'll have more hair loss. Check your vitamin B12, D3, and the ferritin level. Remember, see three things: ferritin, vitamin B12, D3. They are low. You have to take it. Your doctor will recommend. You don't want to take it. Your doctor will recommend. Please don't do any self medication. And the normal thing is proteins. Eat proteins, get good hair. The proteins from chicken, fish, and egg, dal, sprouts, milk, tofu, paneer. These are things you eat there. You get good hair. Sprouts, dry fruits are very good for you. So these are the things to make a hair grow. And doctor, if required, they'll give a supplement containing all the selenium and the biotin combination they give.
Thank you, doctor. And while on the topic, there is a question from Divya. Can we take oral supplements like omega-3 fatty acid, vitamin C, and glutathione tablet?
Why? See, simply don't take any supplement. You don't require supplement unless you have deficiency. Omega 3 is a big myth. Many years back, we used to take omega 3 in big capsules. It's basically pharma oriented. Okay, any capsule is a pharma. Remember that. So pharma-oriented products, and you take two 6 capsules per day. You should take omega. You get your walnuts, you get your fish, egg, you get your dry fruits. All the things get your omega-3 fatty. Good enough. Natural force is good enough. Don't take it. Vitamin C and D. Yes, vitamin C is useless. Don't have to take it. You got your fruits is good enough. Any good fruit is good enough. And D. If there is a low, and all Indians have brown skin, vitamin D will be low. And you are lupus, you don't go in sunlight. Vitamin D will be definitely low. And vitamin D low can trigger lupus. I think you all know about it. Vitamin D low at can trigger lupus. So you have to be careful that you have to take vitamin D properly and not should not do overdose. So we give 60K, 60,000 once a week for 8 weeks and once a month for 8 months. And if you're not, you can take forever once if it is there. And it should not go higher. The vitamin D should not go. You do check your vitamin D every. You should not go high, too high. It's not good for your cardiac, and it should not be too low also. You lose hair. When you have vitamin B12, D3, you lose a lot of hair.
Okay. They've also asked about glutathione tablet. Is it, what does it do?
It's for fairness. It's for fairness. First of all, glutathione capsules don't work. Glutathione injection do work a bit. It's a big uh, money market induced, and a lot of people do use. And you cannot make a fair to make them fair. People take the glutathione injections to make them fair. I'm not given a single patient that. I don't want anyone to make any fair because I'm totally a different person in that context. But it doesn't make a fair permanently. It's only few days you have to keep taking. And glutathione injection is very expensive. And there are few deaths people are taking glutathione injection. No FDC is not approved, and it's your own risk you're taking. There are a lot of beauty parlor giving glutathione injection. Forget doctors. So this is the big thing. People want to become fair. People want to become fair. They get glutathione. Glutathione is it's a hoax. It doesn't make it fair. Capsules. You take at least 6 capsules per day. You take it. It's expensive, and absorption. All those things are variable. So you don't. Injections are better. Injections are have given some side effects. So people don't. And no doctor will give. And it's a big risk. There are people who do. Because there now the thing is the dermatologists have become cosmetologists. So most of cosmetologists have to make them fair, you look nice, because people want shortcut in life. They don't do anything else. They don't need healthy put on. They just want to become fair. So there are people like that, they give injections, big risk in them. I don't recommend, most of doctors, senior doctors don't recommend glutathione. You don't recommend glutathione to become fair.
Yes, got it, doctor. Thank you. And there's a lot of repeatable questions that we can skip that doctor has already addressed. Question from Priya. Can we SLE patients get chemical peels and laser hair removal?
Uh, chemical peel, if the, see what happens, chemical peel, if you do an SLE, it's got a rash, it will become better because you're on steroid. Fine, but if it is just an glycolic acid, it irritates like anything. I have not done a single SLE patient with glycolic acid peel. Maximum, we can do vitamin C peel, that is called the yellow peel. That can be done. It would give us slightly fairness temporarily, but glycolic acid peel is done for acne. So if you get pimples because of the steroid you do, we don't do that. We manage with mild uh, what you call adolescent cream and with topical antibiotic, but we don't do that chemical peel. We don't do it's contraindicated actually. Yellow peel can be done, and because it will burn your skin, and then you if going sun, it'll obviously no. But some people have done for low, very mild peels. Yellow peel patients are begging, want to look nice, you got a function and all, you do that. And what other question? Peel and what other question? Laser.
Laser.
Laser hair removal, the arms and legs and the body hair, not an issue. Facial hair also you can do. If you have thick hair, can be done, no harm. And because laser doesn't cause any problem. And you have to use sunscreen lotion after laser. So no problem in doing it. Thick hair is there, we can do on the body. Laser is not a problem, no contraindication. But peels is that contraindication. Mild peel can be done if it's going to look nice. So these are lovely, now nice, simple peels are coming. You can do that.
Got it. Thank you, doctor. Um, there's one question that says about hair follicles being damaged. How can a patient know that their hair follicles are damaged, and what can we do about it?
That's about a discoid. So in a discoid lupus erythematosus, you get a round like a patch, itchy. In the scalp, it does cause itching, redness, and your skin powder comes, patch, round patch. It's not dandruff. Dandruff is different. Dandruff is to put whole your scalp become little powdery. Here become round and thick and then itchy and painful. The moment you see that, if you have a photograph of nowadays, very easy. You have AI everywhere, you can put it up, what is like Discord. You get this kind of same. Go to your doctor. First thing is don't self-medication, don't panic, and don't Google and see and get worried. Google, I agree, Google. Do your AI search. Come to a doctor. Doctor will tell you what is it. And then if you treat very early, quickly, the treater will take care. Early Discord never have a hair loss. They'll recover also. Whatever has been destroying, going to be destroyed, will be recovered. And HCQS, you start early, you'll do well. And if it is bad, you get short course of steroid, fatafat, you'll stop the progression of disease. Safe, no problem. But in the moment, you're itching, paining, and you have pain and irritation, and the patch hair loss, you come to know. So you have to go to a doctor. Then you cannot celebrate. Very rarely we see so early, okay? Very rarely. People ignore it. People ignore it and it become bad. People don't know. People don't know about discord. When you get it all over the body, then you'll come to know. First, people don't know at all. So anyone always tell them when you have any problem with the skin, we have an association doing the same thing. First, go and check your dermatologist. He will tell you if it is early, which he'll come and make it out. The rest of people don't make out. Physician, cardiologist, nobody can make out. Other doctors don't make out about dermatology at all. So it's a totally a niche subject. Nobody knows about dermatology. And now everyone talks about dermatology. Everywhere there's a real blah blah blah. But physical stuff and that real dermatology nobody knows. If you see in thing, only reels on how to skin care, hair care, blah. Everyone is becoming expert in the reels or whatever you call Instagram or something. But they are not doctors. You're good at dermatologists.
Got it. And we are almost at our time. Doctor, do you have 10 more minutes to spare? Because there are a lot of questions on the chat box.
No problem. I can finish in 4 to 5 minutes. Tell me what are the questions?
Yeah. Is there any permanent treatment for urticaria?
Permanent, no. See, allergy, there's no permanent type of allergy for allergic rhinitis, allergic bronchitis, nothing permanent. So the thing is, there is no permanent treatment for anybody, any conditions. Okay, so many, including any heart condition, diabetes, no permanent. Nothing can be cured permanent. One step, no. Infection, there are permanent. Means once you give an antibiotic, antifungal infection, it can be cured. But urticaria is a condition you have throughout your life. You have to keep taking the medicine, and not throughout life. Sorry, it's an acute and chronic urticaria. Acute urticaria lasts for a few weeks. Chronic urticaria lasts for more than 2 to 5 years. You have to be an antihistamines. According to the conditions we give, there are so many classifications. We have a dermatologist first person to check it out. And a lot of medicines to help you out. Completely controlled can be controlled. Again, mind, stress levels high, your urticaria goes for loss. You plenty of medicine to control. And mind controls. You have permanent cure. Always your mind is calm, relaxed, and lifestyle is good. Many of your skin condition become better. And skin screams at you and tell you your body is not all right. Okay? When skin is showing something, look into it, be serious about your lifestyles. I never have any now in my last 10 years, I never had patients who have good lifestyle in my class, in my clinic. Nobody has got it, except old people who have good lifestyle. Younger generation, hardly anybody asked me, they sleep late, eat late every day, eating outside. This is terrible, terrible scenario. Hmm. Okay.
Exactly. The next question from Nitin is any topicals that could be best to treat post-herpetic neuralgia?
Post-herpetic, no topical. You have to take inflammation. You have to take the nerve problem. You have to take a gabaline, pregabalin. The physicians will give, a neurologist will give you. That is important. Nothing topical. It's a nerve problem. It's a in the spinal cord nerve. The spinal cord and nerve origin is getting damaged. I have to give. Some people give injections spinal cord, injections the nerves here and the thing. To ultimately, we have uh, Jaipur injections and all. So many things are there to finally very bad we give. But otherwise, you should give nerve controlling medicines good enough. No topical.
Got it. So, doctor, what are your thoughts on minoxidil being an alternative for non-scarring alopecia?
Yeah, minoxidil for non-scarring is androgenic alopecia. There is a male and a female pattern for hair loss. There's a that's a balding. There you can give minoxidil. It is safe. You can use it. You have to use it forever. It helps to grow hair. Whatever remaining roots are there, it will come out and remain. You have to use it lifelong.
Okay, doctor. Yes, and last question for the day is, how do you reduce pigmentation caused by HCQS?
Yeah, the dermal once it's the dermal pigmentation, difficult to go. But we have some creams to lighten it up. But first thing is for stop the HCQS the moment you get it. And then what we do is we give sun protection, sunscreen lotion, and cover the body. And topically, it will inflame. We give little topical steroid, and then we also give calcium inhibitor like tacrolimus and pimecrolimus to apply. But it's a dermal pigmentation. It's early is good, late is very difficult and very, very difficult. I have not seen in my life at least 4 to 5 cases of so bad. They have taken ages to improve at least 30%. So normal good routines, moisturizing cream, avoiding sunlight, stopping HCQS, and using this kind of calcium inhibitor drug like calcium tacrolimus or pimecrolimus, it helps a bit. Under doctor, dermatologist care. Don't do self-medication, please.
Yes. That's it, doctor. That's all the questions from our lupus patients. Thank you so much for your time. And I request Priyamvada, our lupus patient leader, to deliver the vote of thanks.
Hello.
You're on mute.
Yeah.
Hello, good evening. Good evening, doctor. Good evening, everyone. On behalf of Lupus Trust India, I would like to first of all extend my heartfelt thank you to Dr. Srinivasa Murthy for today's elaborate and crisp webinar session. A lot of fads were broken, a lot of myths were also addressed. It was very educative, informative, and to the point. And we have been getting a lot of requests for such an elaborate session with a dermatologist. Many patients do ask us. So it was very informative. Thank you so much, doctor, for taking out time out of your busy schedule to help us out with this webinar session. And also, heartfelt thank you to our moderator, Anne, for making sure that this webinar went about smoothly and most of the questions also have been answered, and it was definitely very interactive. I would also extend my gratitude and heartfelt thank you to all the participants who have been a part of the webinar today and made it fruitful and are also helping us in spreading awareness of this disease as such. Thank you so much to the Lupus Trust India Karnataka team for helping us carry out this webinar series. Today was the third out of the fourth part webinar series for this month with no glitches. And a special thank you to the design team also for helping us out in completing this session very well. And any further questions will be answered. The session is recorded. It will be uploaded very soon. And thank you so much, everyone. Thank you, Doctor, once again for
Thank you,
being a part
Priyamvada.
of this seminar.
Yeah. Thank you. What I couldn't get a name, moderator name.
Anlin. Anlin Johnson.
Yeah. She did a good job.
Thank you so much, doctor.
Thank you.
Thank
Bye.
you.
I'll leave now.
Yes, thank you.
Thank you.